This is our ICD-10 coding presentation, and it is by Nico and myself, Purcell. Our first case history is Adolf. Adolf is a 50-year-old male with recent history of pneumonia, complains of weight loss, coughing after meals, chronic nasal drainage, and has a change in appetite. ICD-10 codes that were chosen were J18.9 for the primary diagnosis code, as the client appears to have a recent history of pneumonia. Code R13.1 is the secondary code, as it appears the client has dysphagia due to the pneumonia. And codes Z87.0 and R663.4 were chosen as supplemental codes for R13.1 to specify dietary concerns for the patient in regards to coughing after meals and weight loss. CPT codes that were chosen were 92610, and that was chosen for the evaluation of swallowing function via a bedside swallow to observe oral laryngeal mechanisms needed for swallowing. The second code was 92611, which was motion fluoroscope evaluation of swallowing, and that is due to having little information on the type of food the client is able to eat and his aspiration risk. The third CPT code chose was 92526, and this will be used for the treatment of dysphagia utilizing muscle straightening techniques.
Okay, so our second client's name is Jude, and Jude was born with coloboma, some history of heart malformations, genital abnormalities, conal atresia, ear malformations, difficulty feeding, and some difficulties with his interactions with others. More specifically, he has minimal interactions with his peers. So the ICD-10 codes that were chosen for Jude were 89.8, which is other specified congenital malformations, Q12.2, which is coloboma of lens, Q30.0, which is conal atresia, Q24.9, which is congenital malformation of the heart unspecified, Q17.9, congenital malformation of the ear unspecified, R63.30, feeding difficulties, and Z73.4, inadequate social skills not elsewhere classified. So the reason that we chose these codes is because we believe that based on the case history that Jude has a diagnosis of charge syndrome. So with the little information we have based on the case history, a history of coloboma, conal atresia, heart malformations, ear malformations, difficulty feeding, and his social behaviors all kind of lead us to a diagnosis of charge syndrome. So with the little information we do have, the CPT codes that we felt were appropriate were 92610, which were evaluation of oral and pharyngeal swallowing function, 92611, which is motion, so the MBS, motion fluoroscopic evaluation of swallowing function, 92526, which is the treatment of swallowing dysfunction and or oral function for feeding, 92523, which is the evaluation of speech sound production, and the evaluation of language comprehension and expression, including receptive and expressive language, and 92507, treatment of speech, language, voice, communication, and or auditory processing. So again, just to kind of reiterate, Based on the case history, we believe that the client has a diagnosis of charge syndrome, and the diagnosis of charge syndrome would call for a full evaluation to address his communicative concerns, both receptive and expressive. And we'd do a full oral evaluation of his oral mechanisms needed for the appropriate speech sound production and swallowing function. So we make sure that he's eating the appropriate foods and we're not leading to an aspiration risk. And those were our two clients, and those were the ICD-10 codes and the CPT codes that we chose and felt like were best for both of them. Thank you.